When a patient presents with patellofemoral issues and knee instability, or a patient can overpower a traditional patello support, how do you treat them? Well, that was a question we received from several practitioners looking for a brace that gave solid medial lateral support and addressed the patient's patellofemoral pain. There was nothing that did this well in the market. Initially, we simply added a patellar control strap to our Velocity range of motion knee brace to offer a solution for our customers. As the use of this brace expanded, we went back and asked, how can we build it better, make it closer fitting, and accommodate varying anatomies? Well, we ended up with the new Velocity PS with anterior closure. The need is straightforward, but the execution of building a good brace was tough. First, we had to build a lighter weight support. Support was easy, we've done that for years, but we worked to take out some of the weight while not losing the support nor the compression. We used a new material in the building of the Velocity PS anterior closed brace. It's a material called EcoBound foam, which has the same characteristics to neoprene, yet it's a non-neoprene foam that allows for compression, durability, and heat retention. It's a sturdy brace to build our brace from. The hinges we use are our extremely strong and supportive Velocity hinges with range of motion capabilities. Our Velocity hinge is made from T6 hardened aluminum and tests out as the strongest range of motion hinge that we could find in the marketplace. Because it's made of aluminum, the uprights of the hinge can be bent so the brace can be adjusted to the patient's varus or valgus shape to prevent digging in and promote maximum support and comfort. How we do that, we simply take a goniometer and you can see that this patient has solidly a 15-degree valgus deformity in the knee. To accommodate that with the hinge, we simply take a pair of bending irons, open up the top, and open up the bottom to allow that hinge to very closely mimic the shape of the patient. No digging in at thigh and no digging in at calf, but a nice comfortable hinge against the skin, and we'll do that on the medial side as well. Once the hinges have been bent, they need to be reinserted into the reinforced hinge pockets. We put a piece of Velcro hook on both arms that when the arms are inserted into the pockets, it actually prevents the hinges from easily sliding out or pistoning within the pocket. Simply slide the hinge arm into the sheath, make sure that it anchors all the way to the base. To put the other side in, bend the brace at a 90-degree angle, slide that arm into the sheath, and bring it all the way down. To complete the hinge insertion, simply peel off the Velcro, open up the brace, and attach the Velcro hook to the back of the condylar pad, and the hinge has been reinserted in proper position. Our initial version of the Velocity PS was made as a pull-up orthosis. While a pull-up offers seemingly better compression and more secure fit, it's hard to apply and fits poorly to the conical-shaped leg, the athletic leg, or many legs we see that have some redundant tissues. Turning the Velocity PS into a wraparound brace had a whole host of design challenges, but we were able to accomplish it, and the final brace speaks to the orthosis we desired to build. Simply to apply the brace, it wraps around and secures at the calf first, center the brace on the knee, anchor the calf strap, giving it a little bit of a pull to stretch out the elastics that are built into the strap to allow the brace to move with the patient. Give it a little bit of a pull, anchoring on the top of the gastrocs, and then tightening the calf strap. You'll note that once we get this brace anchored to the calf, it will not slip. To complete the wrap of the brace itself, we just simply secure it at the thigh, and once again do the same thing with the thigh strap. Give it a little bit of a pull, anchor it to the Velcro, and secure the thigh. To address the patient's patellofemoral pain, we added a patellofemoral strap and a floating U-shaped tracheoderm buttress like the one we used in our Shields brace to dynamically position the patella in the most pain-free position. This flap can be adjusted to either lateral sides simply by removing it and fitting it underneath the struts of the hinge to make it a right or left-handed brace. Depending on the maltracking exhibited, glide, alta, baja, rotation, tilt, this dynamic patellar pull effectively promotes pain-free patellar tracking while the knee is being rehabilitated. To adjust the tension on the patella, simply remove the tracheoderm buttress. The tracheoderm buttress has a natural adherent surface to it, so it sticks to the skin. We place that buttress laterally on the patella, and we can then move the patella in whatever direction is necessary to correct the patella maltracking, and then we hold it there with the tensioning strap, the patellar flap. Pulling that over, switching hands, keeping the tension on the patella, and anchoring that final strap. We now have a supportive medial lateral brace with a dynamic patellar control strap. As the brace accomplishes two purposes, it's entirely legitimate to bill for the instability, range of motion, and bendable hinge carcass as an L1832, which is what PDAC determined this brace to be, and separately bill for the L2795 full patellar control add-on for reimbursement. Do you see how the Velocity PS anterior close really fills the void when an unstable knee presents with patellofemoral pain?